Okay. So, hey everyone, I'm Martel Koch, founder of Brown Girl RDH, and I'm here with Sarah Lawrence and Maria Watson, and we're just going to be discussing some topics about the latest hygienists in the dental community, people who have been exposed to COVID-19. Sarah actually has the COVID-19 dental discussion group, so over 2,000 members in that group, and there's some very important information, and so she's going to introduce herself. And here we go.
Yeah, hey guys. So yeah, like Martel said, we started a group back at the very end of February called COVID-19 Dental Discussions. It's a group for all kinds of dental professionals, so assistants, hygienists, dentists, office managers, and we've just continued to grow. I think we're at 12,000 people now, and so it's really taken off, and it's a great resource for people that are wanting to get some science and a little bit of lighthearted humor. So it's a good mix of everything. So yeah. I hope it's a resource for people that are, looking for a little bit of information and maybe just to even connect with other people that are going through the same thing.
Yeah, we'll actually put, I found that group, someone referred me to that group, but I actually found that group, and a lot of information that's in there is really resourceful. So we'll post the link to that Facebook group in the online resource here. But one of the main things that sparked our attention to your group was one of our members reached out, and she was actually diagnosed with, she got her positive results for the coronavirus on Wednesday. So we were able to interview her. She wasn't well enough to be on the camera. And as a hygienist for over 20 years, she was just explaining all of her symptoms, the dry cough, going to multiple ERs and not being, and being told she didn't have it. She had other things like bronchitis or pneumonia, and her being persistent and an advocate for herself in a way that she didn't stop. And then she was actually tested, and she tested positive for it. And this entire time she thought, no way, I can't have the coronavirus because, I'm the Lysol queen and I wear PPE and I do all this stuff and I go home and then she got it. So they did the whole chest x-ray and everything was negative until finally she got her results, which is pretty devastating. If you think you're in this profession and you think you're doing everything to protect yourself, and then boom, you took all universal precautions and then you get it anyway. So it's like, now what, so I just thought it was really important to, I'm not an expert, none of us are experts on the virus, but just to share common questions and open discussion as to what we think about it, what we're seeing in the dental community, and how serious it really is. Since then, one of our members have come forward, and she said, she too was diagnosed and tested positive with the coronavirus, same thing. So I just feel like it's probably a lot more people in our community, but they're not going to come forward because they may be afraid of negative backlash. But this is all in support. Like anybody who needs support, whether it be financial or emotional, our community should be here to lift and keep, and to keep people informed. And, there is a positive side. Most of the people that we're interviewing and seeing, they're not on their deathbed. So just don't let the media scare you into thinking it's just the end. Yeah.
And I think that's important. Like when you shared her story, we're going to post it in the group too. So everybody will be able to go through and watch the interview, which is a really great interview. And like Martel said, she was an advocate for herself. And I feel like that's important, not just for this virus, but, just as dental healthcare providers and professionals that we're going to have those situations where we have to be advocates for ourselves too, and just be aware of the things that are, happening. But I think it's a great thing that you're focusing on the positive part of it, because so much of this is, it's scary and it causes panic and it causes fear. And so people are scared to share their story and, to be vulnerable. So I think what you're doing is awesome, because we need more of that positivity and transparency when dealing with other people that are going through the same thing. Because one of my biggest messages is we are united, we are a profession, and we have to stick together. We're all scared, we're all frustrated, we're going through the same thing. But my hope is that after it's all over, we're able to come together and be stronger and work together better than we were before this this happened. So I love that you're sharing that
Oh,
positivity and happy things that are going on.
I
So I love
know,
that.
I know. Thank you. I saw a post in a group, and a guy had pink eye, and someone's like, there's always panic, and like as soon as someone says something, it's like they're lighting a match of matches, and it's like, oh, everyone's going. So he had pink eye, and then they were like, I heard this is one of the symptoms of coronavirus. It's like, what? And then you start thinking like, let me check my eye, like what's going on? But it's just like, is it one of the symptoms? But we really don't know, because this is all, we just have to keep in mind, it's all emerging. Everything
Yeah.
is new. Like, yeah, maybe your chest x-rays show radiopacity. Maybe they
Mhm.
won't. Maybe you'll have trouble breathing. Maybe you won't. Maybe you have, everyone's not the same.
Yeah.
We're all going to experience things differently. And as new research is emerging, like we need to be careful about saying like, if you have pink eye, you probably have the coronavirus, or you know if you can't, the girl said that the lady, she was telling us she couldn't taste
Yeah.
3 weeks, and I was like, wow.
Yes.
But then you don't hear that in other cases, or
Yes.
maybe you do. So it's like, we really don't know, so we can't really put like, oh, you coughed 3 times in a row, you got coronavirus. Like, can't really
Yeah.
we
And I
can't.
think that's important because I mean, a lot of people are like saying don't post unless it's, research based. Well, okay, I get that. I want it to be scientifically factual, but how do we get to that point? Well, we have to start exploring theories and we have to start looking at data that's not always going to be published because it's new. So, just like what you were saying, and like in that interview, she lost her sense of taste and smell. It's like, okay, this is a common thing. There's not a research paper on it, so you're not going to find it, but it's out there. So we need to have those discussions where we can exchange information and data and just start looking at it. And then another thing was like what you were saying with the red eyes. Like there was a lady that was being interviewed that was working on the front lines in Washington of the first outbreak in that Kirkland, Washington, and she was saying like, it's like they had like red eyeshadow on. She said like but it wasn't on the CDC website. It was just something that she was seeing personally. So just all that, the whole point is to learn and to just gather information, and those things aren't out there yet. So stories like what you're exposing, with Sabrina, that's just important because this is her real life. And these are things that have happened that we're not seeing research articles
Yeah,
or,
yeah,
scientific,
and it's
data
happening.
from it.
And it's happening now, like it's in real time. Like she was exposed that day,
Yes.
she did so like all of those emotions, like this is real. It's not like, oh yeah, been there, done that, got the t-shirt. Like this, she shared in real time what was going on with her, and I just really applaud her for that, because I wouldn't have been able to do it. Like I know she was definitely getting emotional there,
Hmm.
but you know, some of the things that she was saying, I was like, oh my goodness, the whole time. I'm like, you were exposed in February? February? I wasn't as
Yeah.
nearly as cautious. I mean, I'm like this close to the patient's face. Like,
Yes.
but after everything started coming out, I'm like, let me stand up and start doing this trophy. But before then, I'm like, let me see, is this a 3 millimeter pocket? Like, craziness.
Yeah.
So, like, then
And
you start thinking, luckily for her, she had those symptoms when she didn't feel well. She stopped working. And then when she found out, she went back everywhere she had been. And she, like she said, she went to work and came home and really reach out to all of those offices and let them know. But like, we don't know what's going to happen next. I mean, you saw a woman in another group who she can't walk or something.
Well, she was just posting that they just don't want her to get up. I don't know her specific situation. I've just been following in that group, but yeah, I think they took a chest X-ray and it was nothing abnormal, but she's still ill. So I think there are so many things that we just don't know. Like we said, like you and I were talking before we started recording. Well, we may get over it, but what are the long-term implications to our health? We just don't know, and it's important, like you said. We don't want to just go on fear, but we want to be educated and we want to be aware of what's happening out there, and just be open to learning. And even if you don't necessarily agree, it's part of their experience, and people are
Right.
wanting to share, to go, to have a place where they can go through these things. Because like you said, we're going to start seeing a lot more of it in the dental industry, and we just need to be there to support and not to shame anybody or make them feel like they're wrong.
Exactly. And it's okay to have open dialogue and not to be judged. So many people react off of emotion, and it's so easy to be like, well, why are you working? Or, just chillax, just read the comment.
Yeah.
If you don't agree with it, move on. You don't have to, everyone doesn't have an opinion. And then you see the post is like, well, it's just my opinion. And like, okay, we all have an opinion, I
Yeah.
mean, we don't all need to voice that opinion now.
Yeah.
So I don't know, just like you said, we're going to be seeing more and more when we get back to work. Like, I don't know when I'm going back to work, but it was talks about going back. The last time I checked on the 27th, they probably will change it. But I'm like, okay, so are we going to have the N95 mask? Because we're flattening the curve, but it's not gone. Like, it's still going to be an ongoing thing. So, okay, are we going to have the proper PPE to wear? Because if we're not, then I'm going to think twice about going back.
Yeah.
I miss my patients. I love and love them dearly, but I don't want to risk getting the virus and bringing it home to my family. Like, I'm not willing to chance it. Yes, I need money. Yes, I need to work, but the whole country's in the same boat, right? So,
and at the same time, we want to be protected as healthcare providers, but we also have the obligation to protect our patients, from the aerosols that might be still in the air, so this is one, and, I've been trying to look at the positive of things that, that are going to be changing. And I think that we're definitely going to be looking at engineering controls and personal protective equipment changes in screening before the patient even gets there. So I think there are some good things that are going to come from this.
It'll change. Actually, I feel like it's going to change the all the OSHA regulations and the guidelines, and the type of disinfectant that we're using. Are those effective in killing the coronavirus? Because there's more than one strand, and the one that was already out is not the same strand that's out. So the one that your Cavicide says coronavirus, which coronavirus is that? That's not this new one. This is what they're saying. It's like, it's not the latest one because this is a different strand. The coronavirus that's going to kill is something that was already emerged. So I was reading that as well. And I know you said you had reached out to one of the manufacturers of a company.
Yeah.
And what did they say about the disinfectant?
So we do have a resource in the group. It's I did reach out to the manufacturers of the Cavi wipes, and I got a statement from them, and it's a PDF, and so I posted that so people can look at that if they're using Cavi wipes, and look and make sure that what they're using is effective for the virus. And then another company that I reached out to was the Opti Wipe company. Cycan maybe is how I can't remember their big company name, but so they also have a document in that group that you can go through. And then what they had told me was, obviously this is a new virus, so what they're basing their results off of for the effectiveness of it is the SARS virus, since it's the same family. So they can prove that it is effective for the SARS virus. So if it's effective for the SARS virus, then it's effective for this virus. So that's the information that I was given.
Maria and I were talking, and she went to a holistic, to a doctor, and they were saying something about the receptors that the virus actually attacks, and it's different for different people. But it's just like, wow, well, that's new information. Like you said, it's not going to be cited and documented because it's all emergent. Every time you turn on the news and there's another press conference, it's different. It's different information. So this is the unknown. Like, we really don't know. So all we can do is not worry about it and just say, we'll find out when we find out. There's no need staying up till 3:00 in the morning trying to be a detective, because if the people that get paid to do this and make these decisions aren't given the information, you are not going to figure that out on your iPhone 6 and YouTube. Stop looking at the conspiracy theories. Stop researching and screenshotting everything in the Facebook group. Like, just stop. People get paid to do that. You just don't enjoy your vacation, your mini vacation.
That's a good point. I am one of those people that stays up till 3 a.m. looking for information, So
we appreciate it.
We appreciate that. For people like us who don't do that, that come to you. That's why you're here. But you were saying Facebook tends to have the information like later, like it comes out on Twitter, for instance, way sooner. Like, you've been following it since the end of December.
Yeah, I'm just, I love social media. It's probably no secret now. But I love finding information. I love, just investigating things. And what I was finding was back in, I think it was the late December or early January when I started seeing the videos coming out from China about this virus. And that's when I really started paying attention. I really wasn't seeing it on Facebook. I wasn't hearing anybody really talk about it in my circle. I mean, my circle is little. I mean, I'm not obviously exposed to the whole world, but in my reality, nobody had been talking about it yet.
Yeah.
And so personally, I started preparing for this virus back in January. And when I say that, I mean like just things that I thought I might be running low on for my family, for my protection, things like that. So thankfully, I was made aware of it 3 months ago about like, what I could do to protect myself and my family and things like that. So I do feel a little bit more prepared, probably than I would have been if I would have caught off guard by it. But yeah, you're right. I feel like Twitter is really where I was finding a lot of uncensored information. So that has been.
I'll say that my husband is in Korea currently. He's at Camp Humphreys. He's been there since last April, and he called me sometime in February and said, "Hey, I'm not trying to scare you. Let's go grocery shopping, stock up on." He told me to stock up on everything except for toilet paper. And now he's apologizing. He's like, "I completely missed that." He's like, "I had no idea that the toilet paper would become an issue." But he did tell me to go get wipes and non-perishable items. And at that point, we had like 2 cases in the United States. And I was like, I'm fine. We're fine. It's not, if it's going to get bad, it's not going to get bad very quickly. And literally like 2 weeks later, it was bad. And he was like,
Yeah.
I told you to go stock up. And I did a little bit, but I didn't do as much as I should. And no one could have ever foreseen this toilet paper shortage in the United States. So we're down to like 3 rolls. So if anybody has any toilet tissue,
Girl.
North Carolina, let the girl know. But it was good to have the heads up. I was trying not to panic because I had generalized anxiety. But I think there is a need to prepare, and I feel sorry for those who did not have a chance to prepare adequately.
That's me.
It got really bad very quickly. And so he's still in Korea right now. He can't come home. He's supposed to be home April 1st. He won't until sometime in June now because of this virus.
Wow.
So I think it's best that we all practice social distancing. When the virus first got to Korea, they locked the base down for about 2 to 3 weeks, and it was fine. They had it under control. Here recently, they opened it back up, and now it's spread on the base now. So there's several more cases on the base. They've shut down a couple gyms, a couple defects. Like it's getting worse, and we can see the effects of not social distancing. Now it's it's worse over there where it had been getting better when they were shut down and not able to leave the base. So I think it is important that we all practice social distancing to help flatten the curve.
It's gonna spread, and it's gonna, we can do our part to flatten the curve, but it's still gonna be out there. So after this, even if the cases do decrease, then we still have to take into account and that's not for me. Like I said, somebody gets paid to figure that out. What's next? What's next for the dental community? What are we going to be doing differently? So that's just, we'll see. But
I think the first step, in my opinion, is like we've been saying, be open to new information, be open to hearing stories, okay? Because we're not going to learn if we don't learn from each other. So we need to be prepared for that. And we need to be open to implementing and looking outside of the things that we currently do. A lot of people will say, well, we've always done it this way. Well, I'm sorry, that was this is pre-COVID-19. Like, we have to be open to doing things differently. And I think that's one of the most dangerous things that we can do is just say, well, we didn't do this before. Well, now we need to, So just having that open mindset that we don't know everything and we have to evolve as knowledge comes out, and just, it might change our appointment times. It might change our screening procedures, the things that we're willing, or, the things that we protect ourselves with. It's going to be hard for everybody. I mean, it's going to be change. Not a lot of people like change, but we have to be open to doing those things and to continue to protect ourselves and our patients in the industry.
Yeah. What scares me? It's like everybody knows when you're in school for hygiene, they tell you not to do don't do this. This is not how we do it. And then you get in the real world and then they're like, oh no, like you can do that. Or this is a herpes on the lip. Not a herpes, I'm sorry. You don't call it herpes. My kids call it herpes. No, I'm sorry. It's just a fever blister, a cold sore, and it's okay to treat. And you're like, oh no, like in school they told us not to do this. Do the prophet. And then, you know, like, so I'm just scared, like, you know, they're going to have that there's going to be these guidelines, and I hope not, but, you know, it's going to be like, oh, a cough? Oh, you've been out the country? Like, it's fine. Like, just, come on, people. Like,
just a herpes on the lip.
Yeah.
No, it's not just herpes. Reschedule.
Like, I'm not comfortable doing this.
Yeah.
There needs to be something to protect hygienists and any other professional afterwards. Like, you know, I just don't feel safe. Like, I'm gonna need some policies to change and put in writing, because you know you're gonna get those providers that are like, did you cough in a row? No, you're fine. Like, this cough within 5 seconds we'll reschedule. Like, come on, bro. Like,
well, I think that's good. I mean, that's a good point to bring up, because thankfully I work for amazing doctors. I work for 3 female doctors. I work at a pediatric office, and they are open to these conversations. So I think that is like step one. You have to communicate with the people that you're working with. I mean, so many times people are like, well, I can't, you know, I don't feel comfortable doing this, or I don't want to work or without this. That's fine. That's your, I mean, make that call, but you need to talk to the person that you work with, the person that you, your employer, to talk about these policies. You know, things can change. They just have to have that open communication.
Yeah.
Like they have to know that you feel uncomfortable in the first place. They may not have the knowledge and information that you have, that you've been, you know, gathering, and just present that to them, because they may not know, you know. So I want these people, that are struggling with these things, that, you know, like, I don't feel comfortable doing this or that. I think that's great. I want them to know that you have to communicate those frustrations and those concerns to the people that you're working with, because they can't fix it if they don't know.
That's right.
Wow. And maybe your group can be, after all this is done, like a support group for those, because we are going to see, because we don't know where this is going. So we're going to see a lot more dilemmas, ethical dilemmas, with people that are like, you already see them all the time. And I'm just like, ooh. And then even me, I'm like, I don't know. Like, sometimes it's like taking a pin on a pregnant patient. Like, I learned, like, you don't do that. But then you go temp in some offices and they're like, yeah, you take a pin on. I'm like, ooh, dude. Like, and then you're trying to research and post in a group. And it's like, it's coming. It's coming, but, you know, maybe we can have a support group after that, you know, so that's good. Well, anything else? I mean, I'm one of those people that was definitely not prepared. I was driving around looking for toilet paper. My husband was like, I'm good. I got dude wipes. I'm like, dude wipes?
Yeah. You guys, I installed a bidet at my house. So you guys should get one of those. Like, it was a new experience.
Oh, did you? Oh, because you were prior to.
Yes.
So someone said, we're talking about the toilet paper at work when this thing first happened. They're like, no, because the medication that they give you for the coronavirus gives you diarrhea. So everybody was taking. I'm like, what medication, like, that they give you?
It might be the anti-malarial medications, which I have my best friend is a pharmacist, and she's saying that doctors are writing prescriptions for this malaria drug and also for HIV medication. And the patients who really need this medication, primarily the HIV patients, they're experiencing shortages from people prescribing these drugs that are not proven to even help with the COVID-19. So it's really scary out there. Like, a lot of the patients are not even able to get their medications. HIV patients are not able to get their medications. Yeah. So
unnecessary use of it. Yeah.
It's not proven to work, but people are just so scared. So they're hoarding medications, another anti-malaria medication. And then it's just sad, you know, that there's so much fear and panic, and it's really negatively affecting other people, you know, that have nothing to do with it. You know, these patients really need their medication. So no, we'll just see how it goes. But
so Sarah, anything else that you want to share? I know you said you're going to share the video of Sabrina in your group. sharing her story about contracting COVID-19. Wow.
I think the biggest thing right now is like the unemployment thing and
Right.
how people are surviving without working, and whether or not their bosses have to pay them, don't have to pay them, or the stimulus check. Like a lot of, especially hygienists, because I feel like the dental field is probably one of the most hard hit outside of, now some barbershops and beauty salons are closed, but in dentistry, it's like, I think it's Oregon, they can't go back to work to the middle of June. So it's like, how do you survive if you were not financially prepared to, be without income for this amount of time? So do you guys, are you putting out any information on unemployment or, what your rights are, if you have any?
Yeah, actually, that group had so many people that were asking unemployment questions. I was having to try to contain all those questions, and I wasn't successful. And so I just went ahead and did another group, and I just did a group called COVID-19 Unemployment Dental Discussion. So it's pretty similar, but it's all unemployment. And it seems to be working out really well so far. I don't monitor that group as much as I monitor the main one, but I think there's around 3,000 or so people. And we have somebody that has been, Kara Kelly. Her and I did a Zoom interview a couple days ago, so it's posted in there. She's an HR specialist. She's just kind of helping moderate that group, just on the side. And she's been a really good help for people that are asking those unemployment questions. But she's very clear, like, hey, this is not legal advice. You need to contact your state, But she's been there to help offer a little bit of general guidance for those people. So yeah, we do have a resource there. All unemployment questions should go to that group, so we can keep the main group pretty organized and about dentistry, just other general questions. So yeah, hopefully that group will be a resource for people. And if it's not just, it's not going to offer obviously like legal advice, because we're not doing that, but it's a resource for people to share their experiences, like what we're all trying to do. That's what social networking is about, right? Is just connecting with other people and learning from each other and what they've went through, and maybe how that's going to affect what they're currently trying to navigate through themselves. So just a support group, and just maybe some general questions can be answered just by searching through there.
Right. So it's the COVID-19 unemployment discussion group, which I learned about that group and posted a question in there about the House bill. I think it's like 6201. And what that House bill does is it extends the FMLA, the Family Medical Leave Act, and you don't have to ask for it. It's something that your employer offers, and then they're reimbursed by the government federally. And it's not in addition to any paid time off. It's in addition to paid time off. So you have your paid time off if you want to use it, but it's something that your employer has to pay you if you request it. But a lot of people are saying it's the same thing as unemployment. You have to apply. And I'm like, if you're taking family medical leave, you're not unemployed technically. You're just taking leave. So I guess there's a lot of confusion about that one. And there's a really good video in your group that's been shared. An attorney actually breaking it down as to how many employees you have to be eligible, who is exempt, who qualifies. So I think the qualifying is if you have coronavirus, or if you're taking care of someone with the coronavirus, or if you have children, school-age children that cannot go back to school, or if your state has mandated a quarantine, you're eligible for it. So there is an actual document that breaks it down. I thought it was very informative. I actually shared it, but we'll put both links to the COVID-19 dental discussion group and the unemployment group, because I found it really informative. You can take what you need from it. Like, not everybody's going to get everything that's posted isn't going to be for you, but just take what you need and do your further research. It's not legal advice. Like we said, it's just an open discussion and a resource for people who may not have had it. Yeah. Okay, girls.
And I'm really excited to share your video in our group too. I think our members are going to love it. They're going to be able to learn a lot from it, and I think it's just very inspirational to our industry. And I think it's definitely something that was needed. So I appreciate you guys taking that effort to get that video out, and I appreciate Sabrina sharing her story, because that's probably not easy for a lot of people. So thank you guys for all that you're doing.
And thank you.
Welcome.
Yeah.
See you guys later.
Okay, bye guys.
Bye.
Bye.